Hey guys, Kim here, and you are tuned in to Kim E, the Diabetes MP. I am back with another video of our February, our Black History Month series, Black Communities in Healthcare. If you have been following me for any amount of time, you know that I love to take this opportunity to really bring light to the different racial disparities that people of the Black community deal with when it comes to chronic diseases like diabetes. And so I have already made a couple of videos where we've had our little colleague chats where we've discussed the diversity that is within the Black community. Also, we talked about individualizing care and one of the approaches that I use when I do trainings and workshops. Also, I have a couple of different live videos that I have done over the month as well. I will link all that in the description box for you if you want to go back and watch all of that. I do these series to build upon each other, so it probably would be good for you to watch those first before you come over here. But today, we're going to address SDOH, Social Determinants of Health. Now again, if you have been following me for any amount of time, you know that I am big on SDOH, Social Determinants of Health. I have already made a couple of videos over SDOH. It is a very, very, very important thing, not just for marginalized populations, but for all of our patients, okay? And so we're gonna dive into what they are, and we're also going to dive into the importance of SDOH and how that relates to the care that we should deliver to our patients. So one of the things I want to do is define for you guys what SDOH is. And I pulled this from the World Health Organization's website. So I'm just going to read off their statement when it comes to what SDOH is and just a little background over it. So now, according to the World Health Organization, social determinants of health are the non-medical factors that influence health outcomes. And it says that these are the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. Now, they have an important influence over health inequities because this can be more important to their lifestyle choices, influencing their health. And it actually states that there have been numerous studies that account for 30 to 50% of health outcomes, okay? Like half. And so by addressing them appropriately, that should be our fundamental step in improving health and reducing long-standing inequities in health. Okay, so that's what the World Health Organization state. So as you can see, as it's stated, the non-medical factors. So in a nutshell, this is like our patient's life, the things in their life, you know, that affect the way that they're able to manage their diagnosis. So think about it. Our patients spend the majority of their time away from us. We only see them for a snapshot. Really, honestly, if you think about it, depending on how busy your clinic is, you probably only get 15, maybe 30 minutes with the patient, and then you may not see them again for another 3, maybe even 6 months. Some patients, you may only see them once a year. So clearly, our patients spend more time away from us. Therefore, the empowering them to be able to self-manage their own diagnosis is very, very important. But how they are able to manage their diagnosis is heavily impacted by SDOH. So let me read off some areas or higher categories that would be considered social determinants of health, okay? I'm not going to read off the whole list, but I will give you some common ones. Housing, their housing. You think about people who may be homeless or even people who are houseless. Maybe they're living with a family member. You know, maybe their housing is not stable. Maybe there are some issues with their housing. Also, food insecurity. Maybe they don't have consistent, stable food. Maybe they don't have enough for food, okay? Also their working life conditions. Are they at a position that could put them at risk for injury? Lots of, physical labor, thinking about that. Do they have to drive far to get to their job? Income and social protection. We definitely know socioeconomic status plays a lot in just being able to afford treatment, to be able to afford to go to the doctor. That copay, do they make enough money? Do they have enough money to pay for that medication? Do they have the resources to be able to do that? Are they in an area where they feel safe enough to go outside for a walk? These are things that will affect when we know that our guidelines are telling us that people should increase their physical activity. But what if a patient lives in an area that's not very safe? What if they live in an area where maybe the weather is bad and it snows a good piece of the year? I had heard one thing, and I'm not really sure if this is true or not. I've heard a lot of Chicago natives and people who are from Chicago say that throughout the year, there's only 100 days of really good weather in Chicago. Now, again, I don't know. I've never lived in Chicago, but we know that it's the Windy City. We know that it snows a lot there. Well, how would that affect someone who is elderly? Someone who already has some balance issues and outside in the snow and in the ice. Like, you would not advise them to take a stroll around, the neighborhood every single day versus someone who maybe lives in suburbia that has parks right down the street that the weather is mild all year. Thinking about those things, our care has to be tailored, again, like I've been saying, to the individual, keeping in mind the neighborhood that they live in and how much they feel protected and safe. That is something that we have to address, and that's something that we need to screen for. So I've already kind of touched on the importance of SDOH when it comes to healthcare. But my big takeaway point here is that even knowing how impactful SDOH is when it comes to our patients and their health outcomes, you see the stats. I told you what the stat is. It impacts the way that someone can manage their diagnosis. It impacts health outcomes anywhere between 30 to 55%, which is a huge amount. Even though we know all of that, SDOH still goes under screened. So first things first is we need to have a system or a way that we are screening for SDOH in every marginalized population, but in every patient that we see, honestly. As providers, we have to build this into our patient encounter. Now, you can do this through a number of ways. You can do this through patient forms. You can do this through when you're charting. It's a part of your charting system. It's a template that you can, definitely integrate into your charting system. And what I'll do is, if that is something that is very interesting, if you're interested in for your facility, I can put some links in the description box where you can get some resources to be able to start that journey for you. But it's definitely something that we need to be highly aware of, because we need to know what the pain points and the barriers that our patients are facing that will impact their care, their outcomes. Because in some cases, there are things that we as providers can help. There are resources that we can provide to help this, so it's no longer a disparity or a barrier for our patients. Okay, guys, that's all I have. Like I said, I've made a couple of videos over this very topic where I've talked about it in different aspects. And so I hope that you're leaving this conversation more knowledgeable over SDOH and really taking a different perspective. I'll also link in the description box not only some resources, but also the other videos that I have made over social determinants of health. Just housekeeping. If you're new here, I would love for you to go ahead and subscribe, ding the notification bell that's right next to the subscribe button. What you do when you do that is you turn on the notifications for my channel. So when I do an upload, you'll be one of the first people to know, as well as when I do live streams, you'll know when I'm going live as well. If you're on social media, I am heavily over on Instagram at the Diabetes NP. I go live over there. I post a lot of different, videos over there as well, and other just fun content. And then of course I hang out on LinkedIn as well, doing a lot of things with my colleagues and really networking over there. You can find me there at the Diabetes NP, or you can search me Kimberly Ellis. Again, you have been sitting here with Kim E, the Diabetes NP. I appreciate you for tuning in, and I will catch you on the next video. Bye.